What is chemotherapy? Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Chemotherapy is most often used to treat cancer, sickle cell, that and other diseases that have fast-growing cells. Now we're talking about different kinds of drugs of chemotherapy. One drug is alkylating agents. This drug directly damages DNA to prevent cancer cells from reproducing. This drug is mostly used for leukemia, lymphoma, hydrogen diseases, and multiple myeloma and sarcoma. Another type of drug is called topoisomerase. This drug interferes with enzymes called topoisomerases, which help separate the strands of DNA so they can be copied. It is used to treat certain leukemias as well as lung, ovarian, and gastrointestinal and other cancers. Another type of drug is corticosteroid. This drug is a natural hormone and hormone-like drug that is useful in treating some type of cancers like lymphoma, leukemias, and multiple myelomas, as well as other illnesses. Another type of drug is antimetabolites. This drug interferes with DNA RNA growth by substituting for normal building blocks of RNA and DNA. This drug is commonly used to treat leukemia, cancer of the breast, ovaries, and intestinal tracts, as well as other types of cancers. Another type of drug is anticycline. This drug is an anti-tumor antibiotic that interferes with enzymes involved in DNA replication. These drugs work in all phases of the cell cycle. They are widely used for a variety of cancers. A major consideration when you take this drug is that they could permanently damage the heart. Another type of drug is hormone therapy. This drug uses sex hormones or hormone-like drugs that change the action or production of female or male hormones. This drug is used to slow the growth of breast, prostate, or endometrial cancer that normally grows in response to natural hormones in the body. Hormone therapy. Hormone therapy also prevents cancer from using hormones to grow by preventing the body from making the hormones. Disadvantages of chemotherapy. The worst disadvantages of chemotherapy are the short-term negative side effects such as nausea, diarrhea, constipation, dizziness, and extreme discomfort. These side effects may only occur for a certain period after initial treatment. They can be very painful for the patient. When you have nausea, it's most likely you have extreme nausea. You will often have vomiting, heavy diarrhea, and such like that. Hair loss is another disadvantage of chemotherapy treatment, and it is one of the most upsetting side effects. Why does your hair fall out? Hair loss happens because chemotherapy affects all cells in the body, not just cancer cells. The lining of the mouth, stomach, and hair follicles are especially sensitive because those cells multiply rapidly just as cancer cells. This means that the hair follicles get weaker, so it's not able to hold the hair in your scalp. Hair loss usually occurs the second or third week after the cycle of chemotherapy. By the second or third week, you'll be able to pull your hair out of your head painlessly. The hair usually comes out in clumps. All hair falls out, including eyelashes, eyebrows, or even pubic hair. Can you prevent your hair loss during chemotherapy treatment? There have been attempts to reduce hair loss by using tight bands or ice cap. These techniques reduce hair loss by reducing blood flow to the scalp or limiting chemotherapy exposure to the hair follicles. This is a picture of a child that lost their hair during chemotherapy. Another effect of chemotherapy is that the treatment is time consuming. Chemotherapy may take hours at a time, days, weeks, or several months. Sometimes patients have to spend the entire course of the chemotherapy in the hospital. Another disadvantage of chemotherapy is when the course of chemotherapy that you are taking does not work. This means that you're going to have to take another course of chemotherapy, and this chemotherapy may take longer or have more effects, and there is a chance that the cancer may emerge again. You can also have effects of chemotherapy after the treatment. These effects may include heart or kidney problems, lung tissue damage, or nerve damage. Chemotherapy may affect the chance for you to conceive a child as well. Emotional effects of chemotherapy. A lot of patients undergo levels of emotional stress beyond health limits. These emotional effects can come from the medicine the patient is taking or external factors like family, work, or social life. Chemotherapy can have a emotional impact on patients because of the treatment itself is a sign of emotional self-preservation. Another reason why people undergo emotional distress of chemotherapy is because of physical side effects like nausea, weight loss, and hair loss. These can contribute to emotional distress. Chemotherapy also affects patients because perceived burden of loss on family, social life is also dramatically affected by chemo due to fatigue. What chemotherapy does to your brain? Chemotherapy may cause brain cells to die off long after treatment has ended and may be one of the causes for cognitive side effects. Also, chemotherapy may cause neurological side effects such as short-term memory loss and extreme causes of seizures, vision loss, and even dementia. Sometimes the effect to your brain may wear off, but people that have taken chemotherapy for a long period of time experience these cognitive side effects long after treatment has ended. The advantages of chemotherapy are destroying cancer cells, shrinking existing tumors, or preventing cancer cells from thriving and multiplying. Also, some advances are preventing or slowing down the progress of diseases. Sometimes chemotherapy completely eliminates cancer cells or tumors from the body. Advances of chemotherapy. Chemotherapy is also used to shrink existing tumors. The benefit is improving the patient's quality of life by decreasing the pain and pressure caused by the tumor. When you're taking chemotherapy, you will need to practice a healthy eating diet. Staying hydrated, maintaining muscle tissue, and enough fluids, calories, and nutrition can reduce treatment delay, boost the immune system, and help minimize depleting side effects. Exercise is also good for cancer patients. You should do cardio exercises or even lifting weights. It will slow down depleting muscles and keep you healthy. It will also help fight fatigue. This is a picture of somebody exercising. Working while on chemotherapy. If you want to work, it depends on the type of treatment you are getting, the stage of cancer you have, and your overall health, and the kind of job you have. For your safety, make sure you tell your coworkers that you are on chemotherapy so they can keep an eye on you and may give you assistance. Also, if you want to work, you should plan your chemotherapy treatment late in the day or right before the weekend to allow yourself recovery before work. You should also work part time because your body can't take all the stress of working full time. To get ready for chemotherapy, you should start eating a healthy diet. You should do this to get your body healthy and strong for the journey you're about to go on to. You should also bring your friend to comfort you and for mental security. You should also clean up your house for germs so you don't get sick. How do you know the chemotherapy is working? You can find out chemotherapy is working by getting a blood test, a cell count, or tumor marker test. If you have a tumor, you can feel if the lump is going down. You can have an x-ray or CT scan to measure the tumor as well. This is a picture of a shrinking tumor. Where do you go to get chemotherapy? You may receive chemotherapy during a hospital stay, at home, or in a doctor's office, clinic, or outpatient unit in the hospital. This is how a tumor looks. Diseases that chemotherapy treats. One disease that chemotherapy treats is cancer. Cancer is when some of the body cells begin to divide without stopping and spread into surrounding tissue. Cancer can start almost anywhere in a human body. Another disease that chemotherapy treats is sickle cell disease. Sickle cell disease is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels. It is common among the African American descent. This disease can cause seizures, strokes, severe pain in parts of the body, blood clots, and more. This is a picture of sickle cell disease. On the left is a normal red blood cell. On the right is a sickle cell red blood cell. Another disease that can be cured by chemotherapy is anemia. Anemia is a medical condition in which the red blood cell count or hemoglobin is less than normal. Anemia is caused by either a decrease in production of red blood cells or hemoglobin or decrease in loss of destruction of red blood cells. This is a picture of anemia. On the left is a person without anemia. On the right is a person with anemia. Another disease that chemotherapy treats is melanoma. Melanoma is a cancer that develops a pigment cells called melanocytes. Melanoma spreads to other parts of the body and causes serious illness or death. About 50,000 new cases of melanoma are diagnosed in the United States every year. This is a person with melanoma. Another disease that chemotherapy treats is neutropenia. Neutropenia is a condition in which the number of neutrophils in the bloodstream is decreased, affecting the body's ability to fight off infections. This is a picture of somebody with neutropenia. Another disease that chemotherapy treats is keratitis. Keratitis is an inflammation of the cornea. Keratitis has many causes, including infections, dry eyes, physical and chemical injuries, and underlying of the medical diseases. This is a picture of somebody with keratitis. Chemistry applies to chemotherapy in many ways. It applies to chemotherapy because to make the chemo drugs, you will have to use elements from the periodic table. For example, to make the drug insulsamide melaphaline, you will have to use nitrogen and nitrogen mustard. Or if you want to make the drug carboplatin, you will have to use plantium brain-stem coordination. Another chemotherapy drug you need chemistry to make is acetylcysteine, cytarabine, and mercapurine. You have to use deoxyribonucleic triphosphate. A career that involves chemotherapy is an oncologist. Oncologist is a doctor who specializes in treating people with cancer. The three main types of oncologists are medical, surgical, and radiation oncologists. A medical oncologist specializes in treating cancer with chemotherapy. A surgical oncologist specializes in removing the tumor or surrounding tissue during operations. Oncologists often treat a person with cancer in a group. This approach is used because cancer treats frequently involves a combination of surgery and chemotherapy and radiation therapy. Chemotherapy is a very strong drug that has many ups and downs. It might kill you or cure you. It has many side effects like depression or short term memory loss, and it has many advantages like curing you or extending your life.